I'm going to move straight in now. We'll introduce our panellists as we move through each of the individual presentations. So you'll see four people due to present. So I'll introduce our first presenter, which is Dr. Susie Lyons, if I got the name right, Susie, sorry, apologies. Dr. Susie Lyons from the Health Research Board, and Susie's going to present information, and we thank Susie for bringing this to us first. It's just been published this morning, and they've done a lot of work to get it ready for today, the preliminary information. So, over to you, Susie. Thank you.
Thanks very much. Good morning, ladies and gentlemen. My name is Dr. Susie Lyons, and I work with the Health Research Board. And this morning I'm going to present to you trends in drug-related deaths. This is provisional data, and I'm going to very much focus on the year 2020. Now, before I start, what I want to say to you is that I am very conscious that behind each statistic there is a person, and indeed a family left behind. And what I wanted to tell you is that, in fact, the reason I'm here today to be able to present to you this data is because family members affected by drug use, they advocated for a system to accurately record the deaths of their loved ones, and so that this information could be used to help prevent the deaths of other people. So this data comes from the National Drug-Related Deaths Index. And as I said, it was set up because family members advocated for an accurate mechanism to record drug-related deaths in Ireland. And it was included as a strategy, it's included as an action in the 2001-2008 National Drug Strategy. Now, in order to have the most comprehensive and accurate database, we collect data from 4 different sources. Our most important source are closed coronial files, but sometimes inquests do take quite a while to be completed, and therefore our data always has a lag, and therefore that is why I'm presenting the latest data, which is 2020 today. But we do collect data from hospital inpatients, from the Register of People on Opiate Substitution Treatment, and from the General Mortality Register of the CSO. In the NDRDI, we collect two types of deaths. The first type of deaths are what we call poisoning deaths, sometimes known as overdoses. Now, these are deaths due to the toxic effect of one or more substances on the body. We also record what we call non-poisoning deaths. Now, these are deaths in people who use drugs which are not due to poisonings. But I'm going to focus on poisonings deaths first. So this slide shows us the number of poisoning deaths for the year 2011 to 2020. For the purposes of this presentation, we're not including alcohol-only poisoning deaths. We're focusing on drug-involved. And so what we can see here in this data is that really from 2017, there's been a sustained increase in the number of poisoning deaths reported in Ireland. They've increased from 340 in 2017 up to 409 poisoning deaths in 2020, which is the highest number we've reported for the period. And when we looked at this data and the underlying trends, we do know that this increase is not due to, for example, increases in the general population or changes in the age profile of the general population. We can look at the profile of those who died due to poisoning now in 2020. And what we know that 6 in 10 were men. But in fact, for 2020, we see an increase in the number of women who've died as a result of poisoning deaths, and this is a worrying trend that we need to investigate further. For men, we know that half are aged 42 years or younger. We know women were slightly older. We know half of women were aged 45 years or younger. Now, this, I think, demonstrates the burden of premature mortality of poisoning deaths on the Irish population. And for 2020, this equates to approximately 12,000 potential life years lost to Irish society. We do know also that half of those who died of a poisoning death had a mental health issue. We also see that 1 in 5 had ever injected. Now, this is significant because injecting drug use increases a person's risk of overdose and increases their risk of having a poisoning death. We also know in 2020, 1 in 8 were homeless. Now, we can look at the drugs implicated in poisoning deaths for 2020. The first thing to know is that almost all of them were due to a cocktail or a mixture of drugs. 8 out of 10 had more than one drug involved. Now, this is important as well because using more than one drug increases a person's risk of overdose and then makes them more likely to succumb to a poisoning death. In 2020, there was on average 4 different drugs implicated in each poisoning death. And what this means also that, in fact, it does make understanding the trends behind the individual drugs more complex because there's so many drugs involved. But let's look in a bit more detail at the different drugs involved in 2020. Opioids were the most common drug implicated in 2020, with 7 in 10 of all poisoning deaths involving an opioid. An opioid, for example, is heroin or codeine, for example. Now, the problem with opioids is that they confer an inherent higher risk of overdose death because they work on the part of our brain that controls breathing. In 2020, the most common opioid implicated was methadone, which is a prescribed opioid substitution drug. Then the next most common drugs were benzodiazepines, which are a prescribed sedative drug. You might know them as Valium or Xanax. So almost 6 in 10 of poisoning deaths had a benzodiazepine. And when we look at those people, we see that many of them had more than one benzodiazepine. So they might have had, for example, Xanax and Valium. We see that almost 6 in 10 had other prescription drugs implicated, most commonly antidepressants or antiepileptics, for example, Lyrica, which is also known as pregabalin. 3 in 10 had cocaine implicated, and 2 in 10 had alcohol, but this was as part of a polydrug poisoning death. So this next graph I'm going to show you shows you the trends in drugs implicated over the 10-year period to try and have an understanding of the underlying trends. And what you can see there in the yellow line are opioids. And over the period is that opioids have been the most common drug implicated in poisoning deaths. And one of the reasons for this is that historically Ireland has had a very long history of problem opioid use, and problem use of opioids confer a higher risk of overdose and therefore increase a person's risk of dying due to poisoning. So you might be able to see then the black line, which are the benzodiazepines, the Valiums and the Xanaxes. I think you can see is that they actually very closely mirror one another, although there's slightly less benzodiazepines. Now, we know in 2020 that almost all deaths involved more than one drug, 8 out of 10. And so, for example, if you're taking an opioid, such as heroin, and a benzodiazepine, such as Valium, you're taking them together. They're both sedative drugs. They both work on the part of your brain that controls breathing. And so, therefore, you've put yourself at a higher risk of overdose and being at risk of a poisoning death. Now, over the last number of years, as I say, we've seen this sustained increase in poisoning deaths in Ireland. And one of the other reasons for that is cocaine, which you can see in the light blue line there. There's been an over 4-fold increase in cocaine-related deaths over the period. They've risen from 24 deaths in 2011 to 130 deaths in 2020. Now, I think in your other sessions that you've seen how cocaine use has increased in the general population. So unfortunately, if more people are using cocaine in the general population, we can't be surprised to see them appearing in poisoning deaths.
Just 1 minute, Susan, please.
Okay. The database also can tell us where people died and who they were with when they died. So 3 in 4 people died in a private dwelling. So this is their home or someone else's home. It doesn't actually include a squat or a derelict building. These are included in the category public building or place. However, what the data does show is that 4 in 10 of people were alone when they died. So this is a missed opportunity for prevention. There was no one there to call 999 or 112. There was no one there, for example, to administer naloxone, which is the reversal agent for opioids. Now, I'm going to move on and look at non-poisoning deaths. This is the other category. These are deaths in people who use drugs, who've died, but not as a result of poisonings. I hope you can keep up with me there.
Just 1 minute. Yeah,
so this slide shows the evolution of non-poisoning deaths. But really what I wanted to show you was the main cause of non-poisoning deaths. And consistently, you can see in the black line that the most common cause of poisoning deaths non-poisoning deaths have been deaths due to hanging. And in 2020, 108 people who used drugs died as a result of hanging. And we know the most common drug used by this group of people was cannabis, followed by cocaine. We know 3 out of 4 were men. We know they were very young. Half were aged 35 years or younger. And we know, unfortunately, 2 out of 3 had mental health issues. So I'm going to leave you now with those key messages. And I'm conscious I've given you an awful lot of data. It's very top line in a short amount of time, but I'm here available for questions after the session, and I'll be here all day if you had any specific questions that you wanted to ask me. Thank you for your time.